All right. So tonight, just like Lauren said, we're going to talk about primary care, urgent care, and emergency, and how these three options can basically help your pet and help you make the most of your veterinary experience. So we'll jump right in. So our goal for today is to help pet owners, help pet parents make informed pet care decisions. We're going to do some definitions of primary care, urgent care, and emergency. We'll discuss urgent care as an emerging part of veterinary medicine. We're going to separate types of care by presenting symptoms. So we'll talk about some of the things that you might see going on with your pet, and then, what kind of care you might seek if you see those things happening. And then I'm going to give some general recommendations about some of the best ways to get good care for your pet. Just to note, so just like Lauren said, for any specific questions regarding medical issues for your pet, that's best dealt with by calling the VMC or with your primary veterinarian. Vets can't make specific medical recommendations without a valid veterinary patient-client relationship. So just so we understand that. And there may be a few sensitive topics, including pet illness, injuries, no graphic photos, but I just don't want anybody to be surprised. We are going to talk about pet illness and injury, unfortunately. So just to be aware, there will be some terms that will come up that might not be generally known. I'm going to try to define those as we go along. And then, there'll be a little time for questions at the end. So this picture, I like it, illustrates some of the really big differences between urgent care and emergency. This is actually from a human setting, a set of, I think, pretty clever human setting billboards that just tell us the difference in pretty black and white terms between why you would go to an urgent care versus why you would go to an ER. Urgent care, I stepped on a bee. ER, I stepped on a beehive. Or urgent care, I stepped on a mousetrap, versus emergency, I stepped on a bear trap. Now, these are really black and white examples, but we're going to get a little bit more into the nitty-gritty of it as well, and get into the details. But at its most basic level, when we think about primary care, we think about our general practice, wellness care, chronic or long-term pet issues, minor problems that can be scheduled in advance. When we think about urgent care, we think about non-life-threatening but acute or sudden injury or illness. And emergency care, which I'll call either emergency care or ER, we think about life-threatening injury or illness. So we'll start by doing some general just definitions of each topic. So we'll start with primary care, which is going to be the same thing as just a general practice veterinarian, and I'll use those two terms interchangeably tonight. And this is what you think of as your regular vet, the veterinarian that you take your dog or cat to for your normal kind of vet care or vet appointments. These appointments typically are scheduled in advance. Those can be either days in advance, weeks, or even months out sometimes. These clinics tend to have normal business hours, so that's obviously going to vary by clinic. But we think about, 7 to 4, 9 to 5, kind of typical business sort of hours. Some clinics are going to be open on Saturdays or the weekends, some aren't. And this is where you bring your pet for your wellness exams, be that yearly, biannually, kind of whatever your primary veterinarian recommends. And there they do things like vaccines, kitten, puppy visits, old pet exams, all those geriatric exams, nutrition consults, all of those types of things that you think of. This is also where you're going to do things like scheduled surgeries. So small mass removal, dentistry, spays, neuters, of course. These are the types of surgeries that are going to get scheduled. And then primary care veterinarians are also going to see your sick pet. So when you call over and say, yeah, my dog is doing this thing, they'll get you in. That could be same day. That could be days in advance. It just depends on the clinic and what their bandwidth is, what their staffing is, as far as when they're going to be able to get that sick pet in, and that can vary by clinic. So the typical appointment flow at your regular general practice primary care vet is going to be some time spent on getting a history, reviewing the records for this dog or cat, doing a general examination, overall wellness care, and then they're also able to schedule follow-up diagnostics, rechecks, things of that nature. And the diagnostics at your primary care vet are probably what many pet owners have experienced. So blood draws, heartworm checks, radiographs or x-rays, and those kind of general sort of primary tests. So the advantages of your primary care vet, one of the biggest ones is that they know your pet. With familiarity with your pet and their medical history, so they're able to kind of get a sense of the overall lifetime trends that your pet might be experiencing. They tend to have more access to follow-up as well, so they can track, if your pet's experiencing an illness, it's something that your primary vet can track over time. So doing testing, getting results, doing next treatments, rechecking, all of those sorts of things. And typically a general practice vet is a little bit lower cost than your urgent care or emergency. And that mostly is due to the staffing and that they know kind of what the next day is going to bring. So disadvantages that you might find for your primary care or general practice vet is that because everything is scheduled in advance, there is a little bit more limited time and appointment space. So unfortunately, even though I know most vets would want to, they're not always able to see all of their patients that are having issues because of the scheduling that is already there on their books. And they may also be able to perform more advanced care. So depending on the clinic, that might be some things like ultrasounds, or even we get into CT scans or more advanced surgeries. And then depending on the primary care, some of them are able to hospitalize pets, some are not. It just kind of depends on the facility for each clinic. So we're going to skip over urgent care for a minute and go right to emergency care, or ER, kind of that critical care veterinarian, and compare that with primary care. So in this case, cases or pets are scheduled as either call ahead or walk in. Nobody really plans to have an emergency. It just kind of happens. So it's not something that we plan out weeks or days. ER clinics tend to be open either 24/7, so all the time, or after hours, which would just be basically when your regular clinics are closed, like in the weekends or in the evening. At most ERs, patients are triaged and seen in the order of severity. And what that means, what triaging means, is that each pet is evaluated when they come in. So they're evaluated by veterinary staff to see how sick they are, basically. And that helps the staff make the decision on which pets are going to get seen in which order. Because if you have two pets that arrive at the same time to an ER, one is having cardiovascular collapse because they were hit by a car, that pet is going to get seen first, versus a pet that maybe has a broken nail and some minor discomfort. So when we triage, we look at vital signs, so heart rate, breathing rate, effort, all of those different things to decide how is this patient going to get worked into the schedule. And that's something that happens in human ERs too. So like I mentioned, ERs are there to deal with those life-threatening injuries or illnesses. Emergency surgeries, so foreign body surgeries, things like that that are really going to help to save a pet's life, and also then hospitalization and advanced care. So getting a pet that's, say, severely dehydrated in the hospital on IV fluids, that's going to be something that an ER can do. The appointment flow is a little bit different than in general practice, in that we're in an ER are focusing more on the problem that brings a pet in at this given time. So looking more at that kind of a focused history of what's going on with this problem today or in the recent history, doing a general exam, same type of thing as far as a nose to tail exam, looking at the whole pet, but emphasizing and looking for problems. And then moving on to our diagnostics, which might be able to be a little bit more advanced treatments or hospitalization, like I mentioned. Our advantages for emergency care, I mean, it's there when it's needed, and it's a life-saving sort of situation. And that's kind of the big advantage. Disadvantages is that it can be a very long wait because of that call ahead or walk-in nature. Currently, wait times in an ER are anywhere from 1 to 2 to 4 to even sometimes, unfortunately, 8 or more hours, just due to the busy nature and the number of pets needing care. ERs typically are also more expensive, paying for those extra life-saving measures, staffing, tools, all of that. They also have lack of familiarity with the pet as far as compared to a primary veterinarian. Like we talked about, your primary vet, they know your pet, they know the pet's history. With an ER, we're kind of starting fresh every time. So in that vein, they may have limited access to medical history, and then ER services are not usually capable of doing longer term follow-up. So if there are rechecks that need to happen, that's not something ERs are usually capable of handling. So that brings us to kind of right in the middle between primary care and ER is our urgent care. And we'll talk a little bit more about that. So as urgent care veterinarians, it is right in the middle. Cases typically are scheduled on the same day, appointments or call ahead or walk-in. There are several different ways of doing that, but most are not scheduled more than a day or two out. Typically, urgent cares are open in the evening or weekend hours when primary cares are closed, but there are some urgent cares that are open during the day as well. Patients are still triaged, so checked out to make sure that they are stable, their heart's okay, they're breathing okay. But usually then in an urgent care, they're seen in order of arrival. Triage is also important in an urgent care though, because in that case, the staff is actually checking to make sure that this pet is okay to be seen by an urgent care, because if not, they may advise the pet owner to take that pet to an emergency clinic where they can get the proper care. So it's still really important, but it's a little bit different from the triage at an ER clinic. So like I mentioned, urgent care, able to see those non-life-threatening acute injuries or illnesses, limpings, urinary tract infections, those sorts of things. Urgent cares tend to be able to do small surgeries and sedated procedures. So laceration repairs, wound flushes, cat bite abscess care, those types of things where a pet can be sedated, have the problem fixed, and then go home with the owner the same day. And typically urgent cares do not hospitalize. I will say that as a new sort of service, urgent care and ERs, there's some overlap. And so it really depends on the facility. So it's good to figure that out beforehand if you are needing to take your pet to an urgent care or an ER. Appointment flow in an urgent care is really similar to that in an ER. Kind of a focused history and record review, exam focusing on the problem that's going on, diagnostics. Urgent cares can do most of the same diagnostics that primary cares can do as far as general blood work, testing for Lyme disease, x-rays, those types of diagnostics, and then treatment. And treatment typically is focusing on whatever the problem that brought that pet in. So if it was mild dehydration, giving that pet fluids. If it was an infection, treating that pet with antibiotics. Sending the pet home, and then usually recommending that they return to their primary care for follow-up. So Our advantages are those things that are kind of the ability to be right in the middle. It's a decreased wait time compared to ERs, usually less than 2 hours, although that can depend on the time and the facility. Usually a lower cost than ER. Typically, though, a slightly higher cost than a primary care. So again, right in the middle. Some of the same disadvantages, though, of an ER, of lack of familiarity with one particular pet, potentially limited access to medical history like records and such, and more of a limited ability to do follow-up. So we're going to stay on the topic of urgent care just for a minute, because it is actually a really new part of veterinary medicine. And it's something that pet owners, pet parents are learning more about, and actually veterinarians and veterinary staff are still kind of figuring out and figuring out the best way that it works too. It actually wasn't even introduced in human medicine until the 1970s. So it's I'm not going to say new, but newer than our regular models of care there too. And it was introduced in human medicine as something that was more convenient and more cost efficient than basically if you were sick and couldn't get in with your regular doctor, that you had to go to an ER. So the same thing is happening in veterinary medicine. And even in the past 5 years, we've had more and more urgent cares opening. The urgent care at the VMC opened in 2015. So that was about 7 years ago. And I was there when that started. And it was one of the first, I think, actually in the nation, as far as at university hospitals. But in the past couple of years, especially with the pandemic, we have just seen a blossoming of urgent cares, of veterinary urgent cares across the Twin Cities, but also in the country, as there's been that added pressure of folks needing to get in with their pets and not being able to with their primary vet and having the ERs filled. So there's been a lot of new urgent cares opening, and I think that's a really good thing, because it does definitely fill that need and help to serve pets who would have had to wait for care otherwise. So as I mentioned, urgent care kind of right in between primary care or general practice and emergency medicine. But kind of how does that work? Because it's easy to say, oh yeah, it's right in the middle, but what does that actually mean? And unfortunately, because it's a newer sort of model, that can mean different things at different places. So what I'm going to do is I'll go through some different symptoms that you might see in your pet or a pet might experience that would make you think, oh, I should go to primary care versus urgent care versus ER. I do want to say, though, that this can definitely vary by veterinarian. It can vary by exactly what your pet is doing. Very little, unfortunately, in the medical world is exactly black and white. So the best we can do is get some general ideas. And then it's always, always, always a good idea to call a veterinarian and talk through what you're seeing. My first recommendation is always to call your primary vet. They know you, they know your pet. If they are not open, then that's when we can reach out to urgent care and emergency clinics. We're always happy to talk through things and kind of figure out, and I'll have some more information on that later. So this is what our slide system is going to look like as we go forward. We're going to talk about a specific body system, and then I'm going to talk about some different things that you might see in your pet that would make you think about which service to choose. All right, we're going to start with neurologic, so nerve sorts of things or general appearance that you might see. In the category of primary care, or that PC, urgent care, UC, ER, emergency room, PC, we look at things like mild lethargy or tiredness, anxiety, behavior changes, so your dog's just kind of not quite right, intermittent symptoms, so something that happens and then they seem fine the next day, and then you see it again a little bit and then they seem fine. Those are all things probably that should or can be make an appointment with your primary care to get those things checked out. In the urgent care category, we would look for things like mild lethargy or tiredness. So they're just a little droopy that day, maybe. Trembling, shaking, pain. Pain can be difficult to determine in our animals because they can't say, hey, my paw hurts. So the things we look for can be yelping, but a lot of times they won't make any noises or sounds. They just will be acting off or scared or hiding or trembling or shaking. So those can all be symptoms of pain. And as a common refrain, you're going to hear me say a lot, if they're otherwise doing okay, eating and drinking, acting okay, then they're probably okay for urgent care or primary care. If they're not doing those things, we think more about ER. But in this case, some trembling, shaking symptoms, those are good for urgent care. Severe anxiety, so dog that just can't settle down, or mild dehydration. I'm not going to get into too much how we're checking for dehydration, but that would be a dog that maybe isn't drinking as much water or having sticky gums. Those are some things to look for there. In this category for ER, we would look at a dog or cat with dull or inappropriate mentation. What does that mean? Basically, they're just not with it. You look at your pet and they just are not seeming to be all there. That's something that should get you into an ER. Unconsciousness, collapse, severe lethargy. So what that means is a pet, when this pet is normally excited to get up, to go run around in the yard and chase squirrels, and you open the door and your pet just kind of puts their head down. That would be severe lethargy. Severe dehydration, so a pet that's not drinking any water at all, especially for a day or two, really sticky gums, sunken appearing eyes, seizures, or a pet that can't walk. Those are all going to be kind of general things to get you thinking about, I need to make a call to an ER. We'll talk about cardiovascular and respiratory. So this would be heart and lungs. So things that would get you into your primary care or have you call them would be things like an occasional or chronic cough, some sneezing that your pet is doing. If you're seeing mild nasal, so nose discharge, if they've got a couple of snot boogers, that could get you into your primary care clinic. A heart murmur with no other symptoms, and that's usually something that your vet is actually going to diagnose. Urgent care conditions in this category are going to be more of a sudden or acute cough. So that's that really loud, kind of harsh cough you might think of as kind of a kennel cough sounding cough. Or a goose sounding cough for a dog. That's what we think of as an upper respiratory cough. Severe sneezing, so a pet that can't seem to stop sneezing, or lots of gross nasal discharge. Those are usually things that can come into an urgent care. Things in this category for ER are going to be anytime a pet has any trouble breathing or increased respiratory rate, especially when they're resting. I don't really count panting in this category, which is an increased respiratory rate, but that's normal for dogs. For cats, panting is not normal, so that's something to watch out for. Heart failure or collapse. So that's if a pet has an underlying known heart issue and you're starting to see that pet pass out or collapse, good reason to go to an ER. Blue or white gums. So you can check your pet's gum color. It should be nice and pink. Sometimes pets will have pigmented gums, so that just means they have some dark kind of normal pigment color on their gum from their coat color. But in between there should be a couple little spots of pink. It's always a good thing to know what that looks like normally on your pet, because if that changes to white or blue or a muddy purple color, that typically can mean a pet's not getting enough oxygen in some way, shape, or form, and they should go to an ER. Or if we see heavy nasal bleeding, that would be a good indicator to get your pet to an ER. So I have over here kind of spanning the categories of primary care and urgent care, that normal gum color and breathing. That's what we like to see there. So just as a little example, I mentioned that kennel cough. So, you know, this is a dog that was being boarded a week ago, maybe, came home, normal for a few days, and now doing this really loud, hacking, goose-like cough. Almost sounds like something stuck in his throat, but in between coughing episodes is running around, is playing, is happy, is eating, is drinking. That's a good kind of case to consult your veterinarian or an urgent care about. On the other hand, I put up an x-ray and you can see this dog's heart and lungs, but the lungs almost have what looks like a snowstorm going on in there. And this is an example of a fungal disease called blastomycosis. Typically, these dogs, instead of having that just loud cough, are having trouble breathing, are not eating, are feeling really sick, and might have a soft little wet sounding cough. And that's kind of one of those indicators that there's more going on, there's more to the story there. We will move on to gastrointestinal, so mouth to esophagus to stomach to intestines to colon. There's a lot of words here because dogs and cats get a lot of intestinal issues that we need to figure out. So we'll start over in the primary care category. Pets that have occasional vomiting or diarrhea, but otherwise in between they're eating and drinking well. Pets that have mild constipation that comes and goes or passes on its own. Pets with chronic diarrhea, so this is diarrhea that might be happening more often than not, but otherwise their behavior is normal, they have a good appetite, or pets with chronic weight gain or loss. And you're going to see there's definitely a trend that our more chronic issues are over in that primary care column. So moving on to urgent care, the kind of parameters for gastrointestinal issues are going to be things that have come on suddenly. So sudden vomiting, more recent diarrhea. Vomiting is another thing that can also be an ER issue. And typically that's if it's been going on for more than 24 hours, or if there is a known foreign body. So if the dog is known to have eaten a toy, and then suddenly they start vomiting, that does tend to be more of an ER situation. With the diarrhea, it's a very, very common thing, of course, for dogs and cats to experience, and that brings them into veterinarians. For the most part, diarrhea does not typically need to be an ER issue unless what we're seeing is lethargy or dark black tarry stools, because the black tarry stools can actually indicate that there's bleeding higher up in the gastrointestinal system, which can be a much more severe sort of a thing. Anytime there's severe abdominal pain, that's going to warrant an ER visit, or lack of appetite. And I kind of lump water drinking in with this too, but lack of appetite or anorexia for greater than 24 hours. I will mention, I kind of skipped over it in the urgent care column, but I will mention that dogs that have diarrhea will often have a little bit of bright red blood associated with that. That is actually pretty common in dogs. It's an indicator of a condition called colitis, which can just follow on from diarrhea. And most dogs, as long as they're otherwise feeling well, we don't need to worry too much about that. They should be seen, but it does tend to be okay for an urgent care versus an ER. I also put parvovirus in the ER column, and that is typically a disease of puppies. It is something that we vaccinate for, and fortunately, it's pretty well controlled, but unfortunately, we do see still cases of it. And that typically, like I said, is puppies or under-vaccinated dogs, and they get really sick. They have severe lethargy, vomiting, diarrhea, and those guys almost always need really advanced care. I also put parasites with a question mark, because parasites can almost always be handled by a primary veterinarian, but parasites are gross, so we do not mind handling those in an urgent care setting as well. And brace yourself, because the next screen has some parasites on it. So there we go, as promised. So primary care or urgent care can handle all those creepy, gross roundworms that you see, versus, I know I put food and parasites on the same slide, I'm sorry, versus ingestion of grill meat and a skewer, that is going to require an ER trip and probably emergency surgery to remove that skewer from that dog who really, really enjoyed himself for one moment. We'll go over to then urinary, genital problems. So things that would be appropriate for a primary care sort of setting would be chronic urinary accidents or changes. So a cat that has been having occasional accidents outside the litter box. Mild PUPD, what that means is polyuria, polydipsia, and what that really means is increased drinking and urination. So if it's been kind of mild, you're not quite, oh, it started a while ago, I've just sort of noticed it, probably a good thing to make an appointment with your primary veterinarian. Or leaking urine while sleeping, that's another good one for that. In the urgent care category, really any sudden change in urinary, either frequency, production, color, volume, or if there's blood there. Also, we can see any genital sort of discharge. And then in the ER category, things that would be urinary issues for that are going to be things like straining without urinary production. So if there is absolutely no urine coming out, that is a problem that usually needs to be handled by an ER, because if a pet for whatever reason can't produce urine, it can very quickly be life-threatening. Same thing, discharge, so especially vulvar discharge with a lethargy and fever in intact females. Mostly dogs, but also cats. This can indicate a condition called pyometra, which is a severe and life-threatening infection of the uterus. Or if you see from the urinary tract a very large amount of blood with clots. So a little bit of blood in the urine, or even some kind of red urine, that's usually okay for an urgent care. But if there's just a very large amount of blood, that will probably need to be seen by an ER. And then I put dystocia, which is basically problems having puppies or kittens. So if a pet is trying to deliver puppies or kittens and they cannot, that is usually an ER issue because it will probably need surgery, like an emergency C-section. These cute little brachycephalic friends can have problems delivering puppies. So we will see them sometimes coming through ER, needing to go to surgery. It's one of those all hands on deck sort of situation as everybody kind of helps the pet and the puppies all at once. And then the other picture over here is kind of an urgent care or potentially a primary care case. And this is actually a bladder stone. So the central dark portion in the middle is the bladder. The bright white circular portion is the stone. And this is a pet that would present potentially with maybe some straining, maybe some blood in the urine, but able to urinate overall, and basically needs medications, potentially surgery, but hopefully not emergency surgery. We'll move on to skin. There are a lot of skin conditions that pets can get, and it's a common presentation because it's what we can all see. So we know that things are happening. So good reasons to make an appointment with your primary veterinarian are going to be if your pet has kind of new lumps or bumps, they don't seem to be bothering your pet, but you notice them, good thing to get those checked out, sampled to make sure they're not cancers or tumors. Any mild skin infections or rashes, pruritus, which means itching. So if your pet is itchy, they should go to their vet, or matted fur, especially if that's affecting your pet, getting that cleaned up. Also, getting your pet a good groomer is a good step for that. In the urgent care side, we see quite a lot of skin issues. So because these are the things that they can cause your pet some real distress, but they're not true emergencies in many cases, but they shouldn't necessarily wait 2 weeks until they can see their primary veterinarian. So things like ear infections, severe skin infections or pruritus, there's that word again, itching, small abscesses, small wounds, lacerations, things that need to be sewn up or cleaned, facial swelling, hives, so that would be things like allergic reactions. Those are great for urgent care as long as the breathing is okay. They should be seen right away. So if this is something that happens in the morning and the urgent care isn't open until later in the afternoon, they should go into an ER. They shouldn't wait. But if they happen to come in when urgent care is open, urgent cares can probably deal with that. And then things like anal gland ruptures are a good sort of case for an urgent care. In the skin sort of realm for ER, we think about if we have multiple or severe wounds, especially over the neck, trunk, or abdomen, so places where there could be penetration into deeper, more important parts of the body. If we have large chronic or necrotic wounds, so basically rotting wounds, really big abscesses, or any sort of heavy bleeding. And there are some wounds on the next slide, just giving you a little warning. So differences versus urgent care versus ER. So urgent care can deal with a nail in the paw. This poor dog had a roofing nail stuck in his paw, got that out of there, cleaned up, all set, all good to go. This dog, on the other hand, actually has a branch that got impaled into her chest, into the thoracic cavity, and so needed some advanced care to get that all straightened away. Talk about eyes for a minute. I love eyes. I like seeing eyes. I like treating eyes. And that's good because urgent care sees a lot of eyes. So you'll notice that this one, unlike most of them, a lot of the categories are actually in this urgent care category here. But we'll start over in primary care. If your pet has occasional redness or discharge from their eyes or any chronic sorts of vision changes, good idea to get into their general vet. Anything that happens suddenly or quickly for the eyes, redness, discharge, swelling, squinting, cloudiness, any of those sorts of things are all really good ideas to get that checked out fairly quickly. Usually you don't have to rush into an ER, but it should be in the next day or two because eyes can change pretty rapidly. And unless a professional is looking at the eye, it can be difficult to tell what's going on. There are a few eye problems that should be seen by an ER. And I would say that these are a few. Proptosis is one. That is actually when the eyeball is popped out of the socket. So that's a pretty nasty one. That should be seen by an ER because it needs surgery. Ruptured globe, so that's basically a ruptured eyeball, or foreign body. So that's if something actually gets stuck into the eye. And as a little example, so the dog here on the left, the green glow is an ulcer that's actually on the surface of the eye, which it is taking up a lot of the surface of the eye, but it is just the surface of the eye. It can be managed with medicines. That's okay for urgent care. Whereas I put the dog on the right who's sticking their head out of the car, enjoying a lovely summer day, ready to get a foreign body in his eye. I do not recommend dogs hanging their heads out of cars, even though I know they love it. Moving on to orthopedic. So this is bones, muscles. Primary care, good for things like mild limping or chronic orthopedic like arthritis pain, because especially in that latter category, these are things that they're not going to resolve with a day or two of rest. If it's a chronic condition, something this pet is going to be dealing with in the future, then it's good to have a plan with your primary vet to be on a medication course or rehabilitation or kind of whatever that might be. Bones and muscles appropriate for urgent care setting is going to be sudden lamenesses. So your dog is chasing after a ball and comes up lame. Perfect, bring them into an urgent care. We'll see if we can figure out what's going on, get them feeling better. Back or neck pain. It can be difficult to tell if your dog is experiencing back or neck pain. I'm going to bring it back to that shaking, trembling, standing still, freezing. Those can be some of the symptoms. So those are the types of things that we would look for and potentially treat. And then broken claw or nail, that's something that urgent cares can see a lot of. Orthopedic ER problems, fractures, so actual breaks or dislocations, severe swelling or pain in the bones or the limbs, or non-ambulatory, which just means a pet can't walk. So if a pet could walk that morning, something happens and all of a sudden they can't walk or they're dragging their back legs, that's a reason to get to an ER. So sore paw versus a fractured hock, and you can see this little bone fragment here that's actually broken off, and the hock is kind of like our ankle joint. So we're down to our kind of other category, and this is where I put things that I couldn't think of where else to put them, but I still thought they were important. So primary care, general care, like we talked about way back at the beginning, all the wellness, vaccines, heartworm medications, flea tick medications, food, nutrition questions. In urgent care, vaccines can be given. Typically, these are things that need to be boosted in the moment. So things like rabies vaccines after a pet gets bit by an unknown animal. Urgent care, though, is also good for those cases when pet owners and pet parents are just worried about something. They just, there's, your pet best. And we're always happy to check things out. And then the other category in ER is any traumas. So those really awful cases, like when a dog is hit by a car, gunshots, falling off a cliff, you name it. Also metabolic crisis. So DKA, which is diabetic ketoacidosis, Addisonian, liver failure, kidney failure. Most of those things are best handled in an ER service. So I put this together as just a few red flags, kind of, these tend to be ER things no matter what. And that is when a pet is experiencing severe or uncontrolled bleeding, if a pet has loss of consciousness, trouble standing or walking, trouble breathing, a suddenly swollen abdomen or a suddenly painful abdomen, if they can't keep down food or water, severe lethargy, or that trauma category. But wait, what if you're not sure? This is expected. Like I said before, nothing, unfortunately, in biology is as black and white as we want it to be. Everything is a little bit in shades of gray. And so that is where we come in as veterinarians and veterinary staff, and where you come in as pet owners and pet caretakers, because every case is different. Every pet is an individual. You as the pet owner and the pet caretaker, you know your pet best. So if you think that there's something strange going on with your pet, there probably is. So trust your gut on that. And if there's something that you feel should be checked out, we are happy to do that. Once you make that phone call to your veterinarian, then it's the veterinary staff's job to talk through what's going on, figure out, and help you make the choice about where to seek the best care for your pet. And that is included both that phone call that you make, and then also when your pet actually gets to a facility, for the veterinary staff to put their hands on, look at your pet, ask some more questions, and figure out how to best help you and your pet. So general recommendations for helping this process along is, the first thing I always recommend is to call your primary vet, especially if this is not a life-threatening issue. That is always the best way to start the process. If they are open and you can talk to them right away, great. If not, and it's not a life-threatening issue, it might be a matter of getting a call back. If you are concerned or it is more of a pressing issue, then that's when we're going to start going to those urgent care or emergency services. I would still always recommend calling ahead, even in that case, because like I mentioned, then the staff can help direct, saying, oh, no, I don't think this is urgent care. I think you should go to an emergency clinic. Or the other way, maybe it's not as bad as what you think. That would be great. And we can get you sorted out and figure out what the best thing for you and your pet is in that direction. A few more kind of tips as far as making that process as easy as possible. So when you are calling or when you are presenting with a pet, be brief and clear about your concerns. Like let us know what your concern is in this moment, in this day, right now. Always let your vet staff know about anything possible. We're not here to judge. We're just here to help your pet feel better. Any ingestions of your pet or any medications that they're on or any medications that you've given, so that we have all of that information. And then be patient, be kind. Many of you probably know, there have been just a lot of vet appointments in the past couple of years, and a lot of new pets. And we're all doing the best we can as far as helping out pets and helping get everybody the care they need. So being patient and being kind is always appreciated and will always help your visit go more smoothly. So a few more resources for you. On the website of the VMC, so www.vmc.umn.edu, there is actually a little block right at the top of the website with emergency and urgent care resources. And this site has, if you click on the little click here link, it'll bring you to this page that's here on the right. And this has resources for basically all of the current emergency and urgent care vets in the Twin Cities, as well as some of those outside of the Twin Cities, so that there's just a list in case our facility is closed or it's not that close to you. There's a really big list of other places that are available. There's also right here the Pet Poison Helpline, which is great and absolutely recommended anytime your pet ingests something that they shouldn't, as far as they could be a poison. And then we'd also have access to Vet Triage, which basically is a service that helps you walk you through how to make the choice, does my pet need to be seen right now or not, and which service to pursue. So there's more details here on our website as well. So with that, I'm going to start to wrap things up, and we'll get to a couple of questions. But just in summary, the kind of overall themes to take away: primary care, great for things like wellness care, chronic issues, minor problems that can be scheduled in advance. That's the big one right there, things that can be scheduled in advance. Urgent care, non-life-threatening, acute injury and illness. So non-life-threatening, but needs to be seen. And then emergency care, life-threatening injury or illness. So it has to be seen right now. So thank you so much for joining me tonight. I had a good time putting this together. This is one of my cats. I have two orange boys. They're very silly. And with that, we'll take a few questions.
Thank you so much, Dr. Dauenhauer. It was really helpful to see you put everything in buckets, certainly useful information. So we do have a handful of questions. I'll just jump right in. So someone asked, most pet owners don't ask for or retain medical summaries or medical information after their pet's visit with their primary care vet clinic. Can you advise on information all pet owners should ask for and retain, and the formats that's most useful for them to bring to an urgent or emergency setting?
Yeah, that's actually a really good point, because it is super helpful for us to have that information. So the big things that I would recommend keeping and collecting from your pet's medical records, one would be blood work. Like anytime your pet has blood work or any other diagnostic testing, ask for and keep a copy of that. Prescriptions. So make sure you either have a copy of your prescriptions or bring in the prescriptions that your pet is on. And then the third thing would be if your pet has, vaccines too, make sure you have your list of that. But if your pet has any chronic medical concerns, like that they have early kidney disease or you're dealing with diabetes, is to get a summary of what's going on so that you have that. And most vets will either give you that summary or can provide that if you ask for it too.
Great, thank you. You touched on this a little bit. And speaking about patients, could you please address the growing problem of timely access to appointments in any of these three options? Any recommendations that you have for people?
Yeah, it's tough. I will say that I think it's getting better. There's more and more urgent care clinics opening, which is really nice. And really being just an advocate for yourself and your pet. If you think something is going on, start calling your vet and start calling around early so that you don't get into that last minute position of having trouble finding something.
Sure. This is a question about referrals. So do we still need a veterinary referral in order to schedule an appointment at the VMC? And do you know if there's still long waiting times?
That's a good question. It depends service by service, and sometimes it depends week by week. So the best thing I can recommend for that is, again, talk to your primary vet. It's always good to have that relationship. You can always then call the VMC, and the call center staff kind of knows a little bit more about what's going on with that and can let you know, yes, this service needs a referral. This service you can get in.
Okay. And I know at the end you did a great job kind of showing on the website the different services that are available outside of the VMC. So this person is asking, how do we find out what types of services are available in the community, especially in different settings? So in cities or the suburbs or in a more rural setting?
Yeah, so there's the website. There's also, just going on Google and everything. But I would also be proactive in that you can start to look when you're in an area, which clinics are actually near me, what's close to me. There's also more and more groups like on Facebook or Nextdoor of people who have recommendations for different veterinarians or veterinary clinics as well. The other thing I would say, though, is it's always a good idea to actually call and talk to the veterinary clinic, because if you're trying to find somebody who does a specific thing, or you're interested in, say, acupuncture because your dog has chronic arthritis, it's always good to call around and just ask, because most clinics are really happy to say, yeah, we offer this service or we don't, so you know what you're getting into going into it.
Sure, that's good advice. This question is, how much time do you have when you realize that your dog or cat ate something large before it becomes possibly obstructed? I guess probably a dog in that case.
I don't know. Cats can do some pretty silly things too. So it depends. It depends. Usually though, things are going to pass through the gastrointestinal system in about a day. So it's one of those things where if you know your pet ate something big and stupid right away, just call your vet or call your urgent care emergency clinic, and we can advise you, and we'll probably tell you to come on in so we can see if we can get that taken care of. However, usually if it's going to be a problem, it will be in the next couple of days. The caveat to that is if it's big enough to go down the esophagus, but not big enough to pass out of the stomach, sometimes stuff can sit in the stomach for a long time and not really be an issue, and then be an issue later. So there's my it depends answer.
Yeah. Oh, this person said, how do I find a new vet after 40 years and they live too far to come see us for primary care?
Oh no, I think I kind of answered that a little bit before with, looking online. One thing I do want to mention though, is I always recommend, if you are looking for a new vet, to look for one that's AAHA accredited. So that's AAHA. And that's an independent agency that actually holds veterinary clinics to a really high standard of medical and surgery practice. So that's always a good thing to look for.
Okay. This question just came in tonight. Are there any courses for pet parents to take to help manage emergency situations, like a basic life support class for animals?
There are. I was actually just looking at this the other day. So there's a few, there's certainly different websites you can go to. I don't know if we offer one through the VMC. I don't think so right now, but maybe that'll be a future one. I don't know. There are, though, a few sites, like avma.org has a first aid kind of guide and website for pet owners. So that's one resource. There's another one that I like online called veterinarypartner.com. Veterinary partner is all one word. And that also has some first aid resources. And then if you do a quick Google like pet first aid, there are actually a lot of courses out there that you can take. Some are free, some cost money. I haven't done them, so I can't speak to, how good they are. But I know that it exists. Yeah.
Nice. This person asked that sometimes urgent and emergency visits come with a larger than anticipated bill based on what your pet might need. Are there any payment options at the VMC or any financial assistance options?
Yeah, that's the unfortunate part, right? We can't necessarily plan for those sorts of situations. So there's a few things that I'll talk about with this. There's specifically at the VMC, we do accept care credit, which is a sort of a kind of a credit card sort of loan. There's also, depending on the situations, we do have a companion animal fund that can be used to help clients with their pets' injuries and illnesses, again, depending on the situation. There's also in our area specifically a few either low cost or kind of sliding scale, depending on income level clinics that can help too. So if there's a pet owner, pet parent that, is having this need that needs to be met, and we can't meet that at the VMC, sometimes we'll actually have them find care there too, where they can use that sliding scale. The two that are or there's actually, I guess 3 that I'll mention. One is Mission, one is Access Veterinary, and then the Animal Humane Society also has some ability, and they have different levels of care as far as the ability to do emergencies or surgeries, but there are some of those options.
Okay. I think we have time for one more question. Yeah. This speaks to kind of planning ahead. So you talked about finding hospitals nearby. This person wonders if they should kind of do that planning in advance. And then if they do find something near their home or wherever they're staying, should they make sure that that clinic has current records on hand for their pet in the event that they might come in the future?
Yeah, I would for sure know what your options are, like what clinics are near you. Absolutely. I would not necessarily send them your pet's records unless you were going there, because I will, behind the scenes, if we get a pet's records and we have no idea who that pet is, and we're like, I don't know what this is, but you should have it yourself. So like I said before, have your pet's medical records, their blood work, whatnot, or for sure, if something is going on with your pet, make sure you get your recent records from your vet so that you have that just in case. Yeah.